Okay, so if you're listening, maybe you've had that moment, looking in the mirror, seeing things change a bit around the hairline, or maybe finding, well, more hair in the brush than you'd like. It's a really common thing, this hair loss experience, and it often feels like, well, something you just have to accept, a slow surrender. But what if maybe that whole narrative could actually be rewritten? Today we're going to do a deep dive into something pretty exciting happening in the world of androgenetic alopecia. That's the scientific term for common baldness. We're looking at an article from Bibebibebibe Magazine, specifically their Sovereign Diagnostics Spotlight. It introduces a fascinating new molecule, really interesting stuff. So, our mission today, let's unpack this molecule. It's called SH-1. We want to figure out its unique angle on tackling hair loss and, well, understand why it's being seen as such a big step forward. Okay, let's get into it.
Yeah, absolutely. So traditionally, when we talk about androgenetic alopecia, it really has been framed as that slow surrender, like the article says. It's basically seen as this hormonal process, a cascade that sort of shrinks the hair follicle's potential while it's reach. And the main player here, as many know, is dihydrotestosterone, DHT. This hormone, it binds to receptors in the hair follicles, and that kicks off what's called follicular miniaturization. So essentially, your healthy follicles just get smaller and smaller over time. They produce finer, shorter hairs.
Right, until they might just stop altogether.
Exactly, until they potentially stop. And most treatments we've had so far, they focus on disrupting that DHT pathway somehow.
Okay, and this is where SH1 comes in, but with a totally different vibe, right? The article puts it so strongly. To miniaturize a follicle is to erase a story. SH1 is our refusal.
That's powerful phrasing. It positions SH1 less as just a treatment and more like a fundamental challenge to that whole process. It really does. And what makes it stand out immediately is how it challenges it. Drugs like finasteride or dutasteride, they work by inhibiting the enzyme 5-alpha reductase, which converts testosterone to DHT.
They lower the overall DHT levels.
Right. They reduce the amount of DHT circulating in your system, which works, but, sometimes that can cause wider hormonal effects. SH1, though, is different. The article calls it a non-steroidal antagonist molecule. Big phrase. But what it means is it doesn't mess with making DHT. Instead, it goes right to the source, the follicle, and blocks DHT there at the receptor gate.
So it's more targeted.
Precisely. The article calls it elegant receptor level defiance. It's not about suppressing the enzyme everywhere. It's about specifically stopping DHT from delivering its message at the follicle. It essentially outsmarts the receptor, as the source says, without that systemic disruption.
Okay, outsmarting the receptor, acting as a molecular decoy. I love that. That's really fascinating. So how does it actually do that? What's happening at that tiny molecular level?
It really is about precision engineering. The article explains SH1 is designed to mimic the shape of DHT, its binding geometry, just enough so it fits into the receptor's binding site.
Like a key fitting into a lock.
Exactly, like a key fitting the lock. Yeah. But here's the clever part. It's designed not to turn the lock. It fits, but it doesn't activate the receptor. So once SH1 is docked in that spot, DHT physically can't get in. It's like the parking spot is already taken.
Okay. Blocking the spot.
Pretty much. It denies DHT access, and that stops the whole miniaturization sequence right in its tracks. But crucially, it does this locally at the follicle without messing with your overall hormone balance system-wide. It effectively silences DHT's destructive whisper, but only where it counts for the hair.
Wow. Okay, and the article mentions some specific data, something about a docking duel.
Yes, the SH1 versus DHT, the docking duel simulation. They use some pretty advanced molecular modeling, a protocol called C-Docker based on CHARM for the technically minded, and the results were, well, quite revealing. First off, binding affinity. How tightly does it bind? It binds incredibly strongly. The predicted key value was around 2.3 nanomolar, which is almost identical to DHT's own binding strength of about 1.9 millinm. So it's a serious competitor for that receptor spot.
Okay, so it can fight DHT for the parking spot, basically.
Definitely. And then post-stability. Once it docks, does it stay put? The simulation showed it holds a very stable position in the receptor pocket. Very little wobble, you could say. And crucially, it forms 3 specific hydrogen bonds with key residues in the receptor Q711, R752, and T877. These bonds are vital. They lock it in place as an antagonist, meaning it blocks but doesn't activate.
Got it. The bonds are key to it just blocking.
Exactly. And there's another aspect, steric shielding. Because SH1 isn't a steroid like DHT, its different shape actually creates a kind of physical shield. It physically blocks DHT from getting near the binding site once SH1 is there.
And like molecular bodyguard, too.
Sort of, yeah. And when they looked at the competition directly, the curves showed SH1 very effectively pushes DHT out. You only needed a relatively small increase in SH1 concentration to displace most of the DHT. They calculated its apparent kin using the Cheng-Prusoff equation, which just further confirmed this high-affinity blocking action.
So the science really backs up this elegant defiance idea.
It does. The diagnostic implication, as the source puts it, is key. SH1 doesn't just bind, it actively refuses activation. It's a true sovereign antagonist, stopping DHT's erosion at the follicle level without that systemic fallout. It's very specific.
That really is an elegant approach. So,
Yeah.
okay, the mechanism sounds incredibly promising. What about actual results? What have the preclinical studies shown? And, what's next?
Well, the preclinical findings reported in the article are definitely encouraging.
Sorry.
First, in lab assays in vitro using cells, SH1 showed potent androgen receptor antagonism strong blocking with minimal off-target effects. That's important for safety, suggesting it doesn't randomly interfere with other things.
Right, specificity is key.
Absolutely. Then they moved to in vivo trials using mouse models that mimic human hair loss. And the results there were pretty striking. A reported 50% increase in hair density and in the actual diameter of the hair follicle.
Wow, 50%. That's significant. So not just more hairs, but thicker ones, too.
Exactly.
Yeah.
Visibly healthier hair, potentially. And perhaps the most crucial part, the toxicology. The studies apparently showed no systemic hormonal drift, no signs of feminization in the male models, and, as the article states, no compromise.
That no compromise bit really jumps out. That addresses a major concern people have with some current treatments, doesn't it?
It absolutely does. That potential for systemic side effects is a real barrier for some people considering existing options like finasteride. So showing safety on that front is huge.
So with these strong preclinical results, what is the next step?
Yeah.
Human trials must be on the cards.
That's the plan. The article confirms human trials are the next major milestone, though it does mention they're contingent on securing sovereign funding. They've mapped out the phases pretty clearly. Phase 1 is set to start using a topical formulation.
Topical first, that makes sense. Direct application.
Right, applying it directly to the scalp. That could potentially minimize systemic absorption even further, enhancing the safety profile. Then Phase 2 will explore the dose-response relationship, finding the right concentration for different types of hair loss patterns across diverse people. And then Phase 3, the large-scale trials, are intended to scale across multiversal demographics, as they put it, aiming for broad applicability, essentially.
Multiversal demographics. Okay, so stepping back from the science for a moment.
Right.
Why does this all really matter? Is SH1 just about looking better, or is there something more profound going on here?
I think that's a really important question, and the article touches on it quite powerfully. Hair loss, for many people, isn't just cosmetic. It's often felt much more deeply. Sometimes it's perceived, rightly or wrongly, as a sort of outward sign, maybe of hormonal imbalance or stress, or just, systemic wear and tear. It can really affect self-esteem, confidence.
Yeah, it can have a real psychological impact.
Definitely. So when SH1 is framed not just in terms of regrowth, but in terms of reclamation, that word the article uses, it taps into something much bigger. That line, "a follicle reborn is a story reactivated," I think that captures it perfectly. It suggests the potential to reclaim not just hair, but maybe a feeling of vitality or self-assurance or even health that feels lost when hair thins.
Reclamation. I like that. It's not just fixing a problem. It's regaining something. A story reactivated.
Exactly. It elevates the goal beyond just the surface level.
And it seems like the company behind it, Sovereign Diagnostics, sees it that way too. The article mentions they're actively seeking aligned partners, investors, collaborators, even mythic storytellers to help bring SH1 out into the world. They're looking for people who get that bigger picture.
Yeah, it sounds like they have a clear vision beyond just the molecule itself.
Okay, so let's quickly recap what we've unpacked in this deep dive on SH1. We've got this unique non-steroidal molecule that works by cleverly blocking DHT right at the hair follicle receptor, acting like a specific antagonist without needing to lower DHT system-wide. Very targeted.
Right, that receptor level defiance.
Exactly, and the preclinical data looks really promising. Significant boost in hair density and thickness in models, and crucially without those systemic hormonal side effects. That no compromise safety finding.
Very important.
And maybe the biggest takeaway is this idea that it offers more than just cosmetic improvement. It's framed as offering reclamation, a chance to reactivate a story for people dealing with hair loss.
And that idea, a follicle reborn is a story reactivated, it kind of prompts a final thought, doesn't it? Something for you, the listener, to maybe mull over. If hair loss can be seen as this, well, this echo of potentially deeper things happening in the body, and if a targeted intervention like SH-1 can help reactivate that narrative, it makes you wonder what other subtle signals, what other stories might our bodies be telling us through symptoms we often dismiss as minor. And looking forward, how might future science, these really precise molecular tools, help us not just treat symptoms, but actually understand, reclaim, and maybe even rewrite these broader narratives about our own health and well-being?
That's a fascinating question to leave our listeners with, thinking about health narratives in a whole new way. Well, thank you for joining us on this exploration of SH1 and the potential future represents for hair loss treatment. We hope this deep dive has given you plenty to think about.